Volunteers in Medicine of Southern Nevada is the practicum placement I am currently at. The nonprofit organization is a clinic offering free medical, dental, and social services to the underserved and uninsured population in Las Vegas. A significant portion of the patients we serve are undocumented immigrants who cannot afford and qualify for insurance. As aspiring social workers, we learn how to navigate, seek guidance, and utilize critical thinking and decision-making skills when confronted with dilemmas and situations that can cause us powerful personal reactions. The topic and case I'm discussing for today relate to the NASW Code of Ethics Section 6.01 in regards to social welfare and 6.04 in regards to social political inaction. And the reason being is because the case has caused me to think about how consistently we may face this and what to do about it, such as being more politically active and how to advocate towards human rights in our daily lives. There have also been instances throughout this case where I felt it has affected me emotionally because I considered it a hard case. The client was referred to our clinic due to needing medical services and not being able to afford health care anywhere else. When the client was enrolled as a new patient in the clinic, she was set up for an appointment with a primary care provider for a checkup due to reports of chronic pain, nausea, and vomiting. She also reported she was not able to keep food down consistently, and this became a growing concern. The patient was also a Hispanic female in her 30s. She was undocumented, uninsured, and because of her current health concerns, she was struggling to maintain stable employment. She had a small social network map of support with her friend and her sister. The patient was also considered low income and throughout her case reported concerns in maintaining affordable housing. At the beginning of the case, the patient initially lived in an apartment. However, as her condition progressed, this eventually changed. So shortly after, the patient was diagnosed with stage 4 cancer. The main priority was to increase the patient's accessibility to treatment and support. Her physical functioning was affected due to her physical symptoms and inability to eat many solid foods. She also began to develop many depressive symptoms as her condition became more chronic. The main concern of this case was trying to help her obtain treatment such as chemotherapy that would be affordable and obtainable. Due to the patient being uninsured, she would not qualify for Medicaid, and due to her low income and lack of financial resources, she would not be able to afford to pay out of pocket for chemotherapy treatment. As it was reported later on, the patient would eventually be denied chemotherapy treatment at hospitals she would go to since it was not considered obligatory. It was not considered an emergency treatment, and generally speaking, hospitals cannot deny emergency treatment to a patient that will aid in their stabilization, and if the denial of the emergency treatment could lead to their immediate death. And chemotherapy treatment isn't considered an emergency treatment because it wouldn't necessarily lead to their immediate death. As counterintuitive and unfair that sounds. This is actually upheld by a federal law called the Emergency Medical Treatment and Active Labor Act. So, without chemotherapy or affordable chemotherapy treatment as an option, the patient's health continued to deteriorate. The patient was able to be connected to free counseling services, which she reported was a significant support to her. She also accessed out of the community social service programs in order to be connected to various variety of resources in the community, such as food banks, low cost or affordable medical supplies. I'll talk a little bit more about that later on. However, the resources she could access were very limited due to her undocumented status. Many agencies that obtain federal funding actually require people to show proof of citizenships or social securities. And obviously, if they're not eligible if they cannot provide these. So, a significant stressor reported for the patient throughout this case was her financial stressors, along with her inability to eat and her chronic pain. It was noticed that at some points, the patient would need to be given reality statements from the doctor. That was near the end of the case when her condition really progressed and there was a lot of signs of physical deterioration. She would go into stages of denial concerning her condition. So the doctor gave a lot of rationales and reality statements. Patient also had many conversations with the providers and staff in order to become more educated about any other potential options and her condition. Strengths that were reported, though, was how her sister would always be with her at doctor visits. She would always have someone with her in case there was a need for translation services or just for overall support. Her sister and her friend also were pretty good with helping us work out the transportation barrier. Eventually, the patient wasn't able to utilize bus passes, and it was very hard for her to use the bus to get from one appointment to another. So they tended to help out with transportation. So the realistic goals and treatment planning set in regards to the patient's treatment plan was to reduce her financial stressors, as well as promoting her physical and mental health well-being. Objectives such as attending follow-ups per doctor recommendations were provided, and any barriers identified towards progress were discussed so strategies could be implemented. So one example was free bus passes were provided by the clinic to the patient whenever she reported transportation barriers. And this was a continued service she was able to access. And eventually we were able to strategize when she was no longer physically able to utilize the bus. We utilized her social network map of support. The patient was also referred to our internal psychiatrist and psychologist for free sessions. And she would also be referred to support groups within the clinic that were offered at no cost. So as for financial assistance, we made referrals to MEMRA, which is a nonprofit organization that's dedicated to providing people with free to low-cost medical supplies. We would use this consistently with her as it was something that would really help with her support in her physical well-being. We also were able to connect her to the resource of the Governor Office of Consumer Health Assistance, which they tend to help with some form of financial aid when the funds are available in regards to hospital bills, specialist referrals, surgery referrals, and maybe even applying for temporary emergency Medicaid. And this didn't matter if she was undocumented. This is a service offered by the state for anyone. Another type of financial assistance was the Emergency Assistance Program from Bishop Gorman. They tend to provide a one-time per year emergency financial aid in regard to rental or utility assistance. Having consistent communication and discussing this case with other providers and staff during meetings was pretty vital in order to strategize options for the patient. A lot of the techniques and methods we would try to utilize would be motivational interviewing techniques, effective praise, exploration rationales, and reality statements in order to try and promote the support of the patient and empower her. So a transference issue I needed to be aware of was how this case would from time to time cause an emotional reaction out of me. Coming from a family of immigrants, it can be hard to hear the challenges, the current challenges undocumented people are facing today, such as possible exploitation, lack of accessibility to basic need resources such as medical care. I did my best to empathize and be understanding, but I also wanted to be mindful of not letting my emotions get in the way of her treatment nor her self-determination. It was important to utilize active listening towards the patient to try to decrease any possible misinterpretation or misunderstandings. This, I feel, is a continuous area to develop on my part. I also find a lot of support in discussing it during my supervision with my AFI in order to have self-reflections about it. And actually, the support I have the most, in my opinion, is within the staff at Volunteers in Medicine. My colleagues, people there from other disciplinary practices, and my AFI, I believe, are really, really important and vital to my professional growth. They just provide a different perspective. They provide their experience, and it's something I've probably learned a lot from throughout like these past weeks. So it's very important. And it also, the more you work as a team and collaborate, it is more likely you're able to come up with strategies that can work towards the patient, because at the end of the day, the goal is providing them high quality care and having them achieve their realistic treatment goals.